My name is Evan and this is my knee x-ray. First off, I would have my requisition and I would look at the requisition right here with the patient's name and which x-ray the patient's going to need today. So it's a knee x-ray and it's asking for an AP oblique, a lateral, a tunnel, and a bilateral patella. So I would pull that up on the computer and put the required positions, pull them up, and I would go get my patient. RJ?
What's up?
So here's my patient, and what's your date of birth?
10/6/85.
Okay, so I've double ID'd my patient, and he's in the x-ray room, so I'm going to ask you to lay down, sir. So for the first x-ray, which is the AP knee, I'm going to line up the Bucky with an 8x10 or 10x12 grid cassette. I need to line it up. So it's your right knee, sir?
Yes.
Okay. This is detented. Right knee is right here. For the AP, I'm going to center and 1/2 inch below the apex of the patella. So I need to scoot him over just a little bit. So 1/2 inch below right there. I'm going to collimate in and mark it. And to set up the technique, it's going to be a 70 and 5 roughly for RJ here. So RJ, just don't move, stay still, take my exposure with a 5-degree angle. I'm going to change out the cassettes and put the other one into the computer. So next I'm going to do the internal oblique. So RJ, I'm going to have you rotate your knee inward about 45 degrees.
Got it.
So right there. And same 5-degree angulation on there. Our Bucky's lined up. And I'm going to center about the same place. So 45 degrees. Don't move, RJ. So same technique, and shoot the exposure and change out the cassettes. Next I'm going to do the lateral. So RJ, I'm going to have you turn your leg and bring your other leg over to the other side towards me. So your knee is flat down on the side like this. And for this one we're going to use a 5-degree angle again. Line it up below the medial epicondyle. I'm collimated, have my marker again. And the technique's going to be about the same, maybe one more mass, 70 and 6 maybe. So I take this exposure and he's going to have shielding from the beginning. There's a shield. This was put on at the AP. Okay, so that's the lateral. For the next exposure we're going to do the tunnel. So let's move the Bucky, the x-ray tube down. Oh wait. Okay, so for this one, RJ, just go ahead and lay back down. And I'm going to ask you to bend your affected knee. And I'm going to place some glove boxes or something that's, you know, readily available just to elevate the cassette under his knee. So that's like that. And I'm going to bring the tube down and angle it perpendicular to the long axis of his tibia. So that's about perpendicular, maybe a little more angle. And we're going to center it just below his patella. So that's looking pretty good. And we'll go ahead and shoot that x-ray and change out the cassette and be ready for my last x-ray, which is going to be the bilateral patella. So I'm going to remove these. You're doing great, RJ.
Thanks.
So let's grab that cassette again. Okay, RJ, for this one I need you to slightly bend both your knees. Yeah, just like that. And this cassette I'm going to ask you to hold in your hands.
Sure.
And place about, just bring your knees in a little closer and hold it about right there, RJ.
Got it.
I'm going to bring the tube down over here and angle it so it's centered in the joint space between his patella. So this is a bilateral patella. I'm just going to try to center it between the two patellas. Okay, so that's centered right there. I'm going to collimate in. And I'm going to shoot that. Don't move, RJ. And I'm going to take the exposure, change the cassette out, or take the cassette out and pop it up on the computer. And I'm going to review all my images. And if they need to be repeated, I'll repeat them, but they're good.